Hello dear viewers, in this video I will be discussing ventilator dys-synchrony. What is ventilator dys-synchrony? What are the different types? How they are identified? Why they are relevant? And what are the general management principles? I am Dr. Sunil Garg from Essentials of Acute Care. Ventilator dys-synchrony occurs when there is a mismatch between a patient's respiratory efforts and the ventilator's delivery of breath. This can happen during the triggering, inspiratory, or cycling phase of the respiratory cycle, leading to discomfort, increased work of breathing, lung injuries, prolonged days on mechanical ventilation, and potentially impacting patient outcomes. There are mainly three types of dys-synchrony: trigger, flow, and cycling dys-synchrony. What is trigger dys-synchrony? Trigger dys-synchrony occurs when there is a problem with triggering. It is mainly three types and it includes ineffective triggering, means when patient efforts are not strong enough to trigger the ventilator. Double triggering, when the patient triggers multiple breaths at once. And auto triggering of the ventilator. Auto triggering of the ventilator is inappropriate triggering of ventilation when the patient is not attempting to initiate a breath but still ventilator initiate a breath. Here you can see ineffective triggering. It is characterized by patient making an insufficient respiratory effort to trigger the ventilator. This is commonly seen in the setting of autopnea and obstructive lung disease. And this is double triggering. It is characterized by two successive breaths without time to exhale, as you can see here that there is no expiration. This is observed in patients with high respiratory drive. This is flow dys-synchrony. Flow dys-synchrony refers to mismatch between patient's inspiratory flow demand and the ventilator's delivery of flow. It occurs when ventilator does not deliver flow proportional to the patient's demand. It is characterized by scooping of airway pressure, and this scooping coincides with the patient's efforts. It is seen when there is a high respiratory demand. Cycling dys-synchrony. It occurs when the ventilator cycles prematurely or too late, causing a mismatch with the patient's expiratory phase. Early cycling dys-synchrony occurs when ventilator transitions to the expiratory phase while the patient is still making an inspiratory effort. If patient effort is strong enough and flow becomes positive, it is possible to trigger a second breath, creating a double triggered dys-synchrony. Here you can see patient is still making inspiratory efforts while the ventilator has already transitioned to expiratory phase. Delayed cycling dys-synchrony is the result of ventilator transitioning to the expiratory phase after the patient has already started to expire. This is characterized by a sharp spike in the airway pressure at the end of inspiration. Dys-synchrony can lead to increased patient work of breathing, discomfort, and potential lung injury. It can also prolong mechanical ventilation and increase the risk of complications. Recognizing and addressing dys-synchrony is crucial for optimizing patient care. The management strategies include adjusting ventilator settings like trigger sensitivity, flow, inspiratory time, optimizing sedation and analgesia, and potentially switching to a different ventilatory mode. Healthcare professional can detect dyssynchrony by observing the patient's respiratory efforts, monitoring ventilatory waveforms, and assessing patient comfort. Here I finish. Thanks for watching this video. If you have any feedback, suggestions or comments, please write them down in the comment section box. In my next video, I will explore in details about each type of dyssynchrony and how to manage them individually. Till then, bye and take care.